Good morning. I am Dr. Emmanuel Broussolle, Professor of Neurology in the Department of Neurology in Lyon University Hospital. Lyon is a city in the southeast of France. Today we are on Monday, the 23rd of September 2019, and we are at the 12th, excuse me, we are at the 12th meeting of the Movement Disorders Society. It is the meeting this year is located in Nice, in the Riviera, the French Riviera, and I am very pleased to interview Professor Beomseok Jeon, who is a professor of neurology in Seoul, in South Korea. So, Dr. Jeon, could you explain me what was your background in medicine and then in neurology?
All right, okay. Professor Broussolle, I'd like to be called BJ, which makes everybody much more comfortable rather than saying Beomseok Jeon, which is impossible to pronounce. So please call me BJ. I think people will understand who I am referring to. I am currently the chair of MDS AOS, meaning Asian Oceanian Section. I studied medicine in Seoul and graduated from Seoul National University, and then I did my residency in Seoul National University Hospital. But I was lucky to have a chance to be trained in neurology in the States at the University of Minnesota. So I spent 4 years in getting general neurology training in Minneapolis. And then I was lucky again to have a chance to have a fellowship training in New York under Dr. Stanley Fan. And at the same time, I also had a basic neuroscience training in Columbia University again under Dr. Robert Burke. And then I returned to Seoul National University, and then I returned to New York again as a Houston Merit Fellow. And at that time, it was a very nice place to have a clinical and basic science training in New York.
Thank you. So then you started some research, more and more. You have a very impressive series of publications in high standard journals. Could you, before going to clinical research, could you explain what you did as basic science research during your career?
When I decided to return to Korea, I knew that the background of clinical and basic science level in Korea was rather meager, so that I had to do some clinical research from the very basic level, and also I knew that I had to do some basic science together. So I learned both trainings when I was in New York. So when I returned, I studied clinical studies and also some basic studies. And in New York, I learned basic histological techniques like silver staining, immunohistochemical staining, and also making animal models of Parkinson's disease. And it was a rather very small studies at the very basic level, but things grew with time. And I had a lot of good students, and I was able to expand my research area. And also I had a chance to study with other people, like in genetics and neuropathology and neuroradiology. So basically everything that I did was rather new in Korea, so that I was able to get a lot of help from very competent people who became interested in very new area in Korea at that time. Of course, everybody's doing, many people do a lot of things in Korea now.
And in clinical research, What most important work did you in the field of Parkinson's disease and other Parkinsonian syndromes?
The first thing that I did was that because genetics was rather new and also a very interesting area around like 1990 or the late 1990s. So I studied genetics in Parkinson's disease in our population. So I was able to work on our people in new genes like spinocerebellar ataxia genes in Parkinson's disease as a risk or a causative gene for Parkinson's disease. For example, SCA2 is recognized as an important causative gene in Asian population, unlike in European countries. So I was able to work on SCA2, and then I worked on SCA17, which I think is also at least a risk gene for Parkinson's disease. And I worked on PARK2 and other genes causing dystonias and other problems like ataxias.
About PARK2, are these patients more frequently discovered in Korea compared to other places for example, in Europe? Is it as frequent as it is in Japan, for example, PARK2?
Because we are tertiary referral centers, I cannot really generalize to our population. But PARK2 is a very frequent cause of young onset Parkinson's disease in my hospital. Unfortunately, I can really generalize it to compare whether it is more frequent than other countries or whether it is as frequent as in Japan. I cannot do that. But it is a very frequent cause of genetic Parkinson in young onset Parkinson's disease.
In dystonia, did you work on specific gene mutations? For example, dystonia 1, DYT1, for example, or other genetic diseases?
In fact, DYT1 is a very interesting story because when I was a resident in Korea, I met a young girl, I believe she was around 9 or 10, who began to have dystonia in the foot, which became generalized. And I didn't know what it was. But later, I realized that it was a dystonia and read an article, chapter by Dr. Stanley Fan in neurology clinics of North America. And that's when I became aware of Dr. Fan, and I really wanted to study under him. And I vividly remember how the patient looked. And when I returned to Korea, I met several patients with similar clinical features. So I knew that I was dealing with DYT1, which later, where the gene was found. And I was able to find many patients with DYT1. But, you know, there are more genes causing dystonias. And because genetic study on other DYT genes were rather complicated, I worked with other people. And I worked with Chris Klein, who was kind enough to analyze our samples so that we are finding other genes causing dystonias. Right now, I have a very competent geneticist who is interested in movement disorders, so that we are doing our own studies now.
What about the responsive dystonia, Sagawa's disease? Is this more frequent in your country compared, for example, to DYT1?
That is not as frequent as DYT1, but again, we are the referral center, so I was lucky to have many patients with DRD, and I became very interested in the problem, so that I believe I am one of the earliest to describe that dopamine transporter density in DRD is normal.
So using SPECT imaging studies, you mean?
Yes. At that time, we employed the CIT SPECT. Currently, we have FACIT PET, which has a lot better resolution.
Yeah, okay.
So we are using that technique to study many interesting disorders.
Very nice. What about Huntington's disease and Wilson's disease? I saw you published about this. What kind of research did you do in Huntington's disease and as well as in Wilson's disease?
We have a lot of Wilson disease, and I did a study on Wilson disease describing that there is some presynaptic dysfunction in Wilson disease, even though we know that postsynaptic dysfunction, not dysfunction as postsynaptic structural change on MR, but at the same time there is a presynaptic, at least terminal changes in Wilson disease. And also I did some the clinical studies on Wilson disease, how they progress. And in terms of Huntington's disease, it is not common. It is not common in our region.
Okay.
And basically what we are doing is we are doing some clinical studies, collecting patients to prepare them that we can do some neuroprotective or neuromodulative therapies when it comes alive. So we are just, because they do not show up voluntarily to the hospitals, it's difficult to get many patients. So whenever I have a chance to see those patients, I try to have a very intimate collection so that we do not lose the track of those cases.
Now we can, you did so many important publications. What about Amantadine? I saw not only in you, but Korean research on Amantadine is important. Many publications, including yours. Mm-hmm. What could you learn us about your research with Amantadine?
It is one of the studies that I did both basic and clinical researches. We knew based on the study from Italian group that Amantadine, which is an NMDA antagonist, may have a very important role in the management Parkinson's disease in terms of not only just anti-Parkinsonian motor benefit, but also anti-dissonant effect. So I did a study in animals to see whether that NMD, the Amantadine, can have anti-dissonant effect. So that was basic science. And then later, I did a study using IV Amantadine and trying to show that it has anti-dissonant effects, and also may have some effects on freezing of gait, which was not really impressive, and also whether that can be used as sort of rescue therapy in situations where oral therapy is not possible, like the GI operation.
Now, could you tell us about the leaders, the world leaders that impressed you very much, that teach you very much? What about Stanley Fan? You spoke about Stanley Fan. What did you learn with Stanley Fan?
To be honest, when I decided to go to New York, my friends in Minneapolis advised me that New York is such a busy place that you may not like it. When I moved to the United States, I never traveled abroad, and it was a cultural shock to be in the United States. But moving from Minneapolis to New York, I have a bigger cultural shock. Everything was very fast. But Dr. Fan was very kind and very, I should say, patient, a patient teacher. So he was spending more time educating overseas trainee. I'm really grateful for his endurance.
So apart from Professor Stanley Fan, who else uh, which leader was also important in your training in neurology during your career?
There was a neuropathologist in Minneapolis at the University of Minnesota. Dr. Sung was the neuropathologist, and he's a Korean. Of course, because he's a Korean, I get to know him more closely. And he taught me that he is the one who described neuropathology in Menkes disease and also in the spinobulbar muscular atrophy. He's a very good neuropathologist, and he taught me that you have to do a very honest research, okay, not to be swayed by the trend. So I think I try to stick to the principles.
And what about your mentor in Minneapolis during your residency?
I met excellent clinicians in Minneapolis. They did not publish much, but they were very good clinicians. And in fact, it's funny that when I arrived in Minneapolis in 1987, there was a 100-year anniversary of Hennepin County Medical Center, which is a city hospital, which is affiliated with University of Minnesota. So, as an intern, I was sent to Hennepin County Medical Center for a year. And at the anniversary, before starting my internship, I was able to attend the centenary symposium, 100-year anniversary symposium. At that time, I had a lecture by Dr. Mark Mahowald describing parasomnia at the time, which is REM sleep behavioral disorders. I thought it was a very interesting phenomenon. Dr. Mark Mahowald later became my mentor during my residency. And it's interesting to see that I'm studying REM sleep behavioral disorder as a movement disorder specialist. It's a small world.
And what about your investment in teaching to the medical students or neuroscientists in Korea?
Because I am working at the university hospital, it's my obligation to spend more time with students, especially with residents and fellows. And I'm trying to be available at any time. When they're asking questions, I'm ready to answer those questions. And also I'm trying to provide resources that they need and allow them to expand their potentials. I'm not really kind of poke them to do something. I'm just helping them to do what they think is necessary, and they'll find out whether their question was interesting one or not later. Because even though I may know better than them, I really cannot predict what will be important in future. So I think they need to make their own decision and see what their results are.
If we went back 20 years ago, would you, if you could go back 20 years ago, do you think that you would do a different job than the one you did?
Of course, I'll do differently if I knew what will be like now. But at that time, I had no idea what it will be like. So I did my best, what I thought was right at the time. So if I knew what will be like 20 years after, I should have done it different. But I don't think I would do it differently, knowing what I could do at that time. So I tried just to do what I think was right at that time.
And what about the Movement Disorder Society role? What do you think is the main role of the Movement Disorder Society in the field of Parkinson's disease and movement disorders?
MDS is a very important society for me because it gave me a chance to work with others and expand my role as a teacher. I'm very interested in educating other people. And as a chair of MDS AOS, I was able to interact with excellent people so that I could expand my role as an educator. Of course, it gives us a chance to deepen the knowledge, but expanding into areas where movement disorders is underserved is an important thing that I regarded as important.
The last question is the following. Did you experience bias or barriers during your career?
I didn't experience any bias during my spending years at the University of Minnesota and in New York. I told you that Dr. Fan was very kind to spend more time, and he once said that he is much more interested in teaching international fellows because he thinks that international fellows will return to their own country and do something good globally. So I really appreciate his way of thinking, and that's what I'm trying to do back in Korea.
Thank you very much.
Okay, thank you.